All right. Well, good morning, everyone. It is Monday, October 25th, 9:02 a.m. Thank you all for being on the call this morning. I know it's a busy time of year, and I appreciate everyone taking the time to jump on this call. And just as a reminder, if there's a day on a Monday where you can't be on this call, it's okay. We are recording these so you can jump back in and not miss a beat. So just as we start every Monday morning, our mission is to improve the lives of our community with affordable healthcare. So thank you very much for being a part of that mission. And also how we start, we're going to jump right into the training. We don't have a lot of training going on this week across, the carriers, just because it is open enrollment. So we don't anticipate seeing a lot of trainings at this time of year. But I always want to make sure everyone's on the same page here. So as far as the training goes, this morning at 11 o'clock, Devoted is doing a coffee and chat session. So you're more than welcome to jump on that one as well. We also, for every day this week and all throughout the week, HPM Shop training is available on demand. And so Tom took some time and put together a link inside the training calendar. So all you got to do is pop that open, and it's our YouTube video. And so if anyone is a little shaky on HPM Shop or needs a little bit more TLC, you can just click that link and the training is there on demand. If you have any further questions after you've done the training, Tom Ryan is available. His phone number is there and his email is there. But he's also going to be available for question and answer, and we're going to talk about that as well. So that's every day, and you'll find that link at 8 a.m. every day during the week. So I know you guys are using the HPM Shop. So, as you're out there, just know that YouTube video is available. And we cut it into chapters, so that way, if you're looking for something specific, like how to text message the scope of appointment or something like that, you can just jump to the chapter and it'll let you right to that point. So just want to make sure everybody's aware of that. Tomorrow, United Healthcare is doing their 2022 rollout session. This one looks to be a product rollout for the Orlando market. So that's over there in Maitland. So if you're interested in going over there, you can. Just as a reminder, I'm getting a lot of information from the Orlando market, but this is pretty much anywhere in your market. They're doing drive-through kit distribution. So get with your local United Healthcare manager, connect with them, and there are dates and times where you can drive up and grab kits and be on your way. So, if you're running low on kits, if you didn't get a chance to order those kits, we're happy to help you find one of those distribution drive-throughs, but most likely it's going to be in your email, or you can call or text your United Healthcare manager and they'll connect you on a day. Okay. Also, there's another rollout session, same thing as that tomorrow morning at 9:30. It'll be another session at 1:30, and that's in Maitland as well. Moving on to Wednesday, the only training up there is Optum. They're doing a virtual agent academy. So Optum and WellMed, sister companies, are looking for agents to work with. And so there's going to be opportunities available and things like that. But you must take their Agent Academy class in order to get these opportunities. Opportunities range from, events at the office to, events out in the community. We've done telethons before. We've done Facebook ads and things like that. But you as an agent must be certified in their system as a virtual agent. So if you have Optum or WellMed clinics in your market, please be on this training because you're going to learn a lot about what they do. And also you'll be on the list for opportunities. So that training is on Wednesday, the 27th at 4 p.m. Moving on to Thursday, Devoted's doing their coffee and chat session again, 11:30 for the Jacksonville market. Anyone can join if you're interested in learning about Devoted. 1 o'clock on Thursday, Tom got his question and answer sessions. And this is really a key point. I want to make sure everybody is aware. Now Tom Ryan is our coach training. Anything you need on HPM Shop, but even in selling situations, if you have any issues whatsoever, or you have thoughts or ideas, or you're in a selling situation and you're not really sure how, which way to go, please don't forget about Tom. He's a great resource, and he's going to have an open hour on Thursday, 1 o'clock to 2 o'clock. any and all questions, whether from carriers to Medicaid to whatever it is, because I've been getting a lot of questions too, and Tom is a very, very knowledgeable resource. So his number's there, his email's there, tryan@askhpm.com. Just show up, just call into that number there, and we'll connect you there, okay? Also at 2 o'clock, we are doing a training session working with providers. So if you need a little bit of TLC on how to work with providers, please make sure that you are on that call. Last training of the week, WellCare and All is still doing their virtual rollout sessions. This one's on 3 o'clock on Thursday the 28th, and that's a Zoom meeting, so you can jump in. Okay. As always, trainings are available on our HPM calendar. Always have one foot in the classroom and the other one in the field at all times. So really appreciate you guys taking time to do that. Okay, let's move over to HPM Shop. And the first thing I want to cover here is we have some new plans that are now available on HPM Shop, and more to come, really. So Oscar Medicare, yes, Oscar does have a Medicare plan. They have now been added to HPM Shop. So in the Florida market, Texas, and New York market, those plans are available. And then also Global Health has been added to HPM Shop. So Global Health in the Texas and Arizona markets. So if you're doing any sales or have clients in those markets, Global Health and Oscar are both available. Just let us know. And we'll, if you don't have those carriers and you want to add them to your portfolio, just shoot Jessica a message. You can let any one of us know, and we'll get you set up and certified and ready to go. RTS is what we say, right? Ready to sell. All right, speaking of, just a quick reminder, I'm going to share my screen again here, and just a quick reminder to double check your active selling permissions and check your RTS status. Making a quick note, just because you became ready to sell, so let's say you did your Devoted training and you got your notification, that doesn't necessarily mean that Devoted told us that you're ready to sell. So please check in with us, make sure that we have your certification, because that's how we turn on the plans on your HPM Shop, okay? So just a quick reminder to check that. You can go to your account overview, top right corner. You'll see your name. Go to account overview there. And when you scroll down, hopefully it does it here in a minute. There it is. You scroll down, you'll see all of your active selling permissions on the bottom of that screen. And that'll be in order by carrier, by state, by plan type, and by plan year. Okay. It also has your producer ID. So this is your writing number that you should have. So, it's got pages on the bottom right. So if you're looking to make sure that your RTS, ready to sell for Humana in Ohio, this is where you check. Okay. Please, 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 guys, this is your responsibility as a selling agent to ensure that you have all the products properly loaded in your active selling permissions. We've been on this for quite a bit of time, but we're still getting questions, concerns. Why isn't this showing? Because you never let us know. Okay, you got to let us know that you're ready to sell. Send us the notification, and we'll get you loaded in HPM Shop. It doesn't take long to do. We just need to make sure that you are active and ready to sell. Okay. But please check that. That is your responsibility to ensure that you are properly appointed, certified, and ready to sell. Okay. Another issue that may be popping up quite a bit is the scope of appointment. Many of you are using HPM Shop to collect your scope of appointment, and I'm happy for that. Whether it be by text message or email, you're sending it to your clients. Really, really happy to see that. However, I know some of you that are sending it, but it's not being completed. Okay, so please do not forget, this is a CMS guideline. You must complete a scope of appointment prior to discussing benefits. Okay, so don't get caught up in the mix with all the tech and everything is great, and you sent them the scope. You've got to make sure that the scope is completed before you discuss benefits and before you submit the application. You can't go backwards on that, okay? So please make sure you got your scope done first, and then once that's all done, then you can go through the selling part of it. Okay. So don't forget about that scope of appointment. WellCare. So WellCare, we are still working through the issue here with WellCare. I know WellCare is a hot seller this year. We have gotten permissions to add them on HPM Shop. There was a glitch, a mix-up. Last week, we were hoping to have that loaded, but it should be loaded any moment now. There was an issue between Centene and WellCare because Centene is a parent company. WellCare gave us the okay, but Centene still needed to sign off and get that loaded in HPM Shop. So that should be resolved this week. So keep checking back on WellCare. We don't want to take them out of the mix. So just check back on that, and we'll send a notice to ensure that everybody is up to date once WellCare-Centene has been properly loaded in HPM Shop. Thanks for your patience on that. Also, as a reminder, we are running some contests here. I sent it in the kickoff video. If you don't have the kickoff video, please reach out to any one of us at HPM, and we'll be able to connect you with that. So all the contests, everything that we're doing is tied to HPM Shop. Only HPM Shop enrollments will count towards any of the contests. Only HPM Shop enrollments will count towards any of the contests, okay? And I will email this and text it to everyone as well. Paper apps outside of the system will not count. It is because this is how we're tracking it. It's how the carriers are asking us to do reporting. It's how the providers are asking us how many enrollments are coming in. It's all based on that data. So in order to do that, we need to ensure that everybody's on the same page. So please make sure you're using HPM Shop. Many of you are already using it. I'm really, really happy to do that. But I know some of you are still doing paper apps. I get it. Sometimes you got to do a paper app, but it's not going to count towards the points for the contest. So please pay attention to that. All right. Let's also talk about, we're in HPM Shop here, the selling strategy. And many of you are going into HPM Shop, and I'm here and typing in a zip code. I always use 32808. You shop for your plans, and it pulls up the plans. And many of you are sending out quotes, and that's fine to do if somebody really needs to think about it. But remember, your job as an agent is to help them find that plan. Okay. So even if you do a quote, let's say you set up Humana and Care Plus, and you click compare now. When you're doing that comparison, you have the power to send a quote, but the idea behind this software is to get them enrolled. So don't just send out a quote and forget about it and expect that your client's going to enroll, because what's going to happen is they think that you got it all done. There's going to be miscommunications. Okay. So follow up until they pick the plan. And in order to pick that plan, you're going to have to click add to cart. So let's say they pick the Humana plan. You click add to cart, and then you go through the enrollment process. Okay. Only after do you have an enrollment application confirmation number is when the member is enrolled. Okay. If you're sending out quotes, you're kind of doing them a disservice, because unless you're following up and following through, the quote system can cause some issues, and I believe it's going to cause some confusion because people are going to think that they're enrolled, but they're not. Okay. It's a great tool to use, but you've got to make sure that you're paying attention to whether it's a quote or an enrollment, and make sure that your member understands that as far as a quote or an enrollment. Okay. So don't forget about that selling strategy. Okay. The main thing, and just to walk you through this, is when you're setting up somebody as a new profile on the top right, new beneficiary, this is really where you want to start, because you're going to build their needs analysis. You're going to build their profile, their preferences, and that's going to tell you exactly what plan is going to be best for them. I can't stress this enough, because what it's going to do is it's going to allow you to add in all their medications and allow you to do all of those doctors as well, any doctor that they're seeing, and it's going to limit down the plans. It's extremely helpful. It's going to save you hours of work over open enrollment, searching different formularies, searching different provider directories. This thing does it for you. So use it to that advantage. Take the time, build the profiles, connect the MyMedicare.gov account, add the providers, add the pharmacy, because when you do your due diligence, you will not have to come back and change their plan in 6 months or a year next year. Okay. The idea in this business is to build your book of business, put them on the right plan for the right reason, and you won't have to keep switching them every year. Okay. Perfect example of that. I had a client that called me and they were concerned, and I said, okay, I'll take a look at what you've got. And they were on the right plan. We did our due diligence from the very beginning. And so there they go. They're ready to get re-enrolled. So that's going to cause you to open up your ability to do more marketing, because you know that you're setting your clients up in the right way. Now, we know things change. We know their health changes. We know their doctors change. We know benefits change every year. So the good news is by setting up a profile, next year, if any of those things change and you do have to make a change with your member, that all the information is saved. All the medications are saved. All the doctors are saved. And so you don't have to rework. So that's going to save you even more time next year versus having to add all those things back in and go out and search all the formularies and all the providers. I know many of you are still doing this manually. So guys, this is a top of the line software system. The call centers use this exact system across the country. And so, the only thing that you have to really worry about is marketing and building that relationship with your clients. Okay. So don't forget about that selling strategy, because I think it's super, super important. Okay. A couple of plan updates here. Humana does have the Medicare risk adjustment fee. Just as a reminder, it's $50 if you're doing your HRA forms, your health risk assessment forms, at the backside of the applications. Many of them are available on HPM Shop. You just bounce right out after the application. Both Humana and Care Plus do require an additional training. I believe Cigna also requires an additional training. So just check in if you're not seeing those HRA forms or you're not sure how to do an HRA form. There are specific trainings on how to get that done. But that's extra money in your pocket. So for instance, with Humana, you get an extra $50 for completing that HRA form, and it's connected through HPM Shop. And if you forget to do it, you can go back. There's a timeline. I believe it's 72 hours after. So if you've done an application in the last 3 days, you should be able to go back in there and complete that HRA form. But some of these carriers do require that you have training complete. So make sure that you've got that training complete. You can go out to, for this instance, Humana's University and get that done. Okay. Other news, United Healthcare has added Shands. Here in Florida, Shands is pretty big with University of Florida. So Shands is now in network as of October 1. So that's pretty big news, especially for the cancer treatment centers. Shands has been really big on that. So that's going to impact, just in my mind, the Gainesville market, the Marion County, Alachua market, and then you've got Jacksonville market as well, which is Duval and Clay counties, I think are going to be impacted as well. So United Healthcare is now in network for October 1 with Shands, University of Florida. So in case anyone was looking for that provider, there you go. Okay. Last thing I'm going to spend the last part of this is I wanted to share with you guys one of the plans that is out there that you guys may not be aware of or have paid attention to. And this is for my Florida folks, just because I have seen this plan be overlooked. And anytime I see something this hot, I always want to make sure that I'm sharing it with everybody. So I'm going to share my screen here, and we're going to go through real quick the summary of benefits for Bright Health. Bright Health has a give back Part B savings plan, a give back PPO. Now they're in several markets, and when you pull the PDF, which I pulled from HPM Shop, it's going to have all the same plan in all of the counties that it's offered. So just make sure you pay attention to that. So for instance, in Central Florida, Orange, Osceola, Pasco, Seminole, and Volusia County. That particular plan is 010. This is a give back PPO product, which is a PPO, allows you to go in or out of network, no referrals, but it also gives money back into the Social Security check, just like a give back HMO. Okay. So pay attention to where this is being offered, because you'll see that Central Florida is on page 37 of 48. So just make sure that you're quoting benefits correctly. So first is first. This is a give back PPO. There's 0 monthly premium, $110 back in your Social Security check. I did not stutter. This is a Medicare PPO giving back $110 per month. Okay. It's the highest and best PPO give back plan in this market. Very, very rich benefits. Primary care doctor is 0, and the specialist is $30. If you go out of network, it's 0, and the specialist is only $40. How about that? So you could still go out of network and see your specialist for an additional $10. No big deal there, right? Max out of pocket is in network. If you stay in network, it's $4,400. So that's competing with other HMOs. Really like that. Hospital's a little high. We get that because this is a give back plan and it's also a PPO. So we expect the hospital copay to be a bit higher at $235 per day from days 1 through 7. Then after that, it's 0. Surgeries, $200. But all your preventive services are 0. Emergency room, $90. Not a big deal there. It does include hearing and a bit of dental. So you've got dental, you got x-rays, cleanings, exams, all that 0. And then they do have some comprehensive dental. There's copays on that for sure. So if you need extractions or implant services, there are copays on that, but it's pretty strong. And then on the vision plan, you've got the exams, you got the glasses, you got the frames, you got the lenses. They give you $175 for your glasses. So that's really, really nice. Vision, dental, and hearing. I mean, this is on a give back PPO product. Pretty strong, right? The drugs look good. There is a deductible. So, just be aware of that on the tier 2 through 5. But the generics are 0. Brand names are 47, and the non-preferreds are $100. Okay. Other benefits: Meals on Wheels after a hospital stay, 15 meals. They've got acupuncture. They've got a free gym membership for silver sneakers. That's included. 24/7 doctor on call. Free emergency response unit. And this is something that's overlooked on a lot of plans too. You guys may have remembered the help, I've fallen and I can't get up. Well, a lot of these plans are offering that free. And if you go out and buy that, it's about $50 to set it up, $50 to $100 setup cost. And then it's anywhere from $30 to $50 a month, depending on which service you go with. But this has GPS and fall detection 24 hours a day, 7 days a week, 365 days, which is amazing, right? So that's included in the plan as well, in case somebody does have a fall or an emergency, okay? But I wanted to point out this plan specifically because it's very, very unique. And we don't have a lot of give back PPO plans in this market. I see them up north a bit because PPOs are a little bit more popular, but we see that PPOs are becoming more and more popular here in Florida as people are transitioning down from up north. So this is a give back plan that gives you $110 a month back in your Social Security check, and it's a PPO, in or out of network. Now, one thing to know about Bright Health is their network is Advent Health, and I'm a huge fan of Advent Health. Had several things done there at Advent Health. And so wonderful, wonderful organization, a faith-based hospital system, and they really do things right. So knowing that you've got a really strong doctor network and hospital network behind a unique cutting edge product like this, I think you guys really need to pay attention to this plan. And again, this is Bright Health's Give Back PPO product. They're calling it the Bright Advantage Part B Savings Plan. So the Part B Savings Plan, specifically the one that I went through today, is a 010. But they do have it in other markets. So just make sure that you're there and you understand on how that plan works. We also have a manager, Dan Formoso, who's available, and he will answer any questions that you might have. But it is also in Lake and Sumter. The benefits vary slightly, so just pay attention to that. Also available in Broward and Palm Beach counties, and also in Sarasota as well. So just pay attention, making sure that you're quoting your member properly, and you're not giving them the wrong copays, because the copays do vary per area. Okay, that's it on my side. Those are the updates for this week. Just as a reminder, we are recording this call. If you do have any suggestions or thoughts or ideas on what we should cover on Monday, I am very, very happy to share that information and ensure that the rest of the team gets that knowledge, because I'm sure you appreciate it when others share their info. So with that, I wish everyone a fantastic week. If you have any questions, concerns, give us a call, 844-696-3975. You guys know how to reach us. You can reach us by email or on our website, joinhpm.com. Thank you guys very much. Have a fantastic week, and go get them.